Impedance is characteristics of the medium only. Impedance is not measured, it is calculated and represented by the letter Z. Z equal density times propagation speed, and units are rails. Typical values is 1.25 to 1.75 mega rails. Reflection of an ultrasound wave depends upon the difference in acoustic impedance at the boundary between the two media. If you have a small difference, some beams will make it in, some will go back. If you have a huge difference, virtually everything goes back, reflected back or bounces back to the medium it came from. So the mismatch, or the how big or how small is the mismatch, that determines whether the sound beam is all going to reflect or whether some beams will make it in, some will go back. Impedance, that's the resistance of the propagation of the sound wave. Okay, so the formula Z equal density times propagation speed, and units are rails. So if acoustic impedance equals these two factors multiplied, density and propagation speed, increasing any one of them will increase the impedance. What happens if I increase density? Impedance will increase. If I increase the propagation speed or the velocity of the sound beam, impedance will increase. Okay, the two factors in the equation, if you increase any of them, the impedance will increase. Okay, so one more time, what is the reflection? Sound bounces back to the medium it came from. What's the reason? Difference in acoustic impedance. What is acoustic impedance? Is density times propagation speed, and is the resistance to the propagation of the sound wave is equal to density times propagation speed. What units do we use for impedance? Rails. And what letter we use to represent impedance? Z. Okay, any of the two factors in the equation, if we increase them, the impedance will increase. So if Z equal P times C, if I increase the density or increase the propagation speed, that will increase the impedance. So the impedance, the amount of sound reflected or transmitted, depends on the degree of impedance. If you have a huge, large difference in acoustic impedance between medium 1 and medium 2, the greater amount of reflection will occur and there will be less transmission. If the impedance difference is very small, some will make it in, some will go back. Okay, so the impedance difference between air and soft tissue at the transducer creates the need for gel. Is huge difference in acoustic impedance. If you don't use gel, you don't see any images on the screen. When we use gel, we push that thin layer of air away from the face of the transducer, that layer of air between your skin and the transducer. And when we push it, so there is no difference in acoustic impedance now, and sound will transmit through the skin interface. If we don't put gel, then we have a thin layer of air. And the difference in acoustic impedance between air and soft tissue is huge. So virtually all the sound beam will reflect back and nothing will go through the skin. It happens only with oblique incidence. The amount of reflection depends on the impedance. Impedance depends on the density of the medium and the propagation speed. Impedance of muscle and soft tissue is almost the same, so you don't see so much of reflection. Maybe just 1% of the sound beam will reflect back. Okay, impedance between muscle and bone is a little bigger, so 50% of the sound wave will be reflected back. Impedance between soft tissue and air is very big, and that's why 99% of the sound wave is reflected back, and that's the reason why when we scan with the transducer with no gel, we don't see an image on the screen. Okay, according to the surface sound beam is hitting, we have different types of reflection. If the sound beam is hitting a surface that's large and smooth, we call this surface a specular surface. A large and smooth surface is a specular surface. What kind of reflection we get with the specular surface is specular reflection. What is a specular reflection? See, it is very neat reflection. The way the sound beam came in is the way it's reflecting back. Of course, we have difference in acoustic impedance for this to happen. So this kind of reflection that happens with large and smooth surfaces is called the specular reflection, where the angle of incidence is equal and opposite to the angle of reflection. If sound hits a rough surface, what will be an example of a rough surface? Liver parenchyma. If sound hits a rough surface and you have difference in acoustic impedance, The type of reflection we get in here is called diffuse or backscatter. Just like taking a crystal glass and drop it on the pavement, it's going to shatter and scatter everywhere. This is what happens to the sound beam. It will reflect in so many different directions. If there is interference after scattering, that will create a speckle. A speckle is a noise that makes your image looks grainy. Another type of reflection happens with a small moving reflector. What is small and moving in our body? Red blood cells, for example, okay? So if we have difference in acoustic impedance and sound hit this red blood cell, this type of reflection we get in here is called the Rayleigh scattering. So the reflection that happens with large, smooth surfaces are known as specular surfaces, as we said. What will be an example of that? Vessel, intima, pericardium, pleura, diaphragm, bone and soft tissue. Okay, small interfaces are known as scatters. And we said if we have interference after scattering, that will create, with the rough surfaces, will create a speckle, which is a noise that makes your image looks grainy. Scattering occurs when the sound interfaces with reflectors with rough edges. Sound is sent in many directions. Scattering allows us to image the tissue boundaries that are not perpendicular to the sound waves, and echoes that are scattered back towards the transducer are backscattered. Acoustic speckle texture or seen in the image or may not correspond to the tissue texture, okay? So when we have a speckle, it makes your image texture looks different, it looks grainy. Results from interference effects between the multiple reflector received, and they added together, that's constructive interference, and subtracted from one another, and that's destructive interference, okay? So there is interference after scattering. Okay, so what are the different types of reflection we learn? Is specular reflection. We said the specular reflection happens with the specular surfaces. What are those specular surfaces? Large and smooth surfaces. So if you see here in specular reflection, the way the sound beam came in, the way is the sound beam leaving, and of course we have to have difference in acoustic impedance between the two medium. Z1 should be different from Z2. If the surface is large and smooth, the type of reflection we'll have is called the specular reflection. The angle of incidence will equal and opposite to the angle of reflection. Diffuse or backscatter is a type of reflection we will get with rough surfaces. What will be an example of a rough surface? Liver parenchyma, kidney parenchyma. We have to have difference in acoustic impedance for reflection to occur. If the surface is rough, what kind of reflection we'll have? You see, it's reflection going in so many different directions. That's called diffuse or backscatter. What happens if a beam hits and backscatter? Another beam hits. We have difference in acoustic impedance, so the reflection is going to be diffuse or backscatter. Another beam hits this rough surface. There is scattering. What happens if there is interference after scattering? A speckle will form. A speckle is a noise that makes your image looks grainy. So it causes artifacts. It makes your image looks grainy. It will have a texture that doesn't correspond to the normal anatomy of the structure. And the type of reflection we get with small moving reflector like red blood cells is called the Rayleigh scattering, when the sound reflects in many directions. It's a special type of scattering. Reflection occurs with both oblique and normal incidence if there is difference in acoustic impedance. We said for reflection to occur, we have to have difference in acoustic impedance. So with both incidences, the oblique and normal. What is oblique incidence? We said when the sound beam hits with an angle other than 90 degrees, less or more than 90, that will be an oblique incidence, so we can have reflection with that. And with normal incidence, when it comes exactly at 90 degrees, so that's the normal, the perpendicular, the 90 degree, the orthogonal. That reflection can happen also with that incidence, with the normal incidence, if there's difference in acoustic impedance. Reflection, perpendicular incidence, normal incidence occurs when the direction of the sound travel perpendicular to the boundary. Reflection will also happen with this perpendicular incidence, and when the incidence is not perpendicular, it's oblique. So with oblique incidence, reflection will also happen. So it happens with both oblique and perpendicular. Let's discuss reflection with normal incidence. So if sound hits exactly at 90 degrees, this is called the normal incidence, the 90 degree, the right angle, the perpendicular or orthogonal incidence. Okay, so this with normal incidence, if there is Z1, for example, equals 40, Z2 of medium 2 is 60, the difference is not that big. Some of the beams will make it in, some will reflect back. So initial intensity is the intensity the sound beam came in with. This will be divided by what is transmitted and what is reflected. So the initial intensity will be divided by IT and IR, intensity of transmission and intensity of reflection. If I take intensity of transmission, IT, and divide it by the initial intensity, I will get intensity of transmission coefficient, ITC. And if I take my intensity of reflection and divide it by the initial intensity, I will get intensity of reflection coefficient, IRC. If I add these two, IRC and ITC, I should get 1 or 100%, what the sound came in with. Okay, so both of them will add to 1 or 100%, and 1 minus any one of them will give you the other one. Let's say you have 75 cents and 25 cents, you have $1 now. $1 minus 25 cents is 75 cents. $1 minus 75 cents is 25 cents. So if IRC and ITC equal 1, 1 minus IRC should give you ITC, and 1 minus ITC should give you IRC. 1 minus any one of them will give you the other one.